Hello, everybody. This is Susie with Healthy Expressions and Hope. Okay, so tonight we're talking about food allergies. And I've really only had experience with one type of food allergy, which is milk allergy or lactose intolerant, but not myself, my daughter, and my grandson. Okay, so what you need to know about food allergies are there are several common types of food allergies, and their symptoms vary. So they could go from gastrointestinal, which could be canker sores, which is like the small little ulcers you get inside your mouth, and that's usually like a like a slight gluten allergy. Chronic diarrhea, celiacs, which is the severe gluten allergy, and ulcers, IBS, gastritis, malabsorption, ulcerative colitis. That is one hard word to say, but that's basically where it's like your intestine area near your colon is like a huge ulcer. It's very painful. I know a couple of people that actually have that, and it's very, very painful. Urinary, which is bedwetting, chronic bladder infections, immune system, which is chronic infections, especially ear infections, mental and emotional, which can be anxiety, depression, hyperactivity, lack of focus, insomnia, irritability, mental confusion. So that would be kind of like dementia type symptoms, and personality changes or seizures. And I find that very interesting because myself, I have a general seizure disorder, and I have a sibling that has epilepsy. So then you also have muscular skeletal, which could be bursitis, joint pain, lower back pain, respiratory, which is asthma, chronic bronchitis, wheezing, which kind of falls in between the asthma and the chronic bronchitis because you have wheezing with both. Skin can be acne, eczema, hives, itching, or skin rashes, and then you have like a few miscellaneous things, which is arrhythmia, which is irregular heart rate or heartbeats, headaches, itching nose and throat, which would be just kind of like a general everyday allergy symptom, fainting, fatigue, hypoglycemic symptoms, migraines, and sinusitis. A lot of people could fall in that category, but there's most people, when they think they have a food allergy, they go to the doctor, they get the skin pricks test done, but come to find out those are only about 10 to 15% accurate, so you may not want to rely solely just on that. Okay, so some fun facts about allergies. They're inherited. If both parents have allergies, then the children have 67% chance of being allergic. If there's only one parent, like me and my husband, he doesn't have allergies, but I do. So our children had 33% chance of having allergies. And since we only have two, our daughter has allergies, our son does not. So the common allergens, food allergies, you have citrus, which is both children and adults, eggs, both children and adults. Adults have fish or shellfish allergies. Milk can be for either children or adults. Hi, Leanne. Then you have nuts, which can be both, but most common in children. Peanuts, soy, wheat. Soy and wheat are both children and adult allergens. Strawberries is 9 times out of 10 just for children, and onion and garlic, which is adults. So children aren't typically allergic to those. Okay, so the best way to figure out if it's a food allergy is to do an elimination diet. So an elimination diet is you take all the allergenic, hey Crystal, you take all of the allergenic foods out of your diet and replace them with the hypoallergenic foods. So hypoallergenic foods are lamb, chicken, potatoes, rice, and I'm assuming like brown rice since white rice has gluten in it, bananas, apples, cabbage, broccoli, and Brussels sprouts. So those are considered non-allergenic. You do the elimination diet for a week up to a month, just depending on how fast your symptoms disappear, which typically would be 5 to 6 days after you start it. Your allergy symptoms will disappear, and then you can slowly start reintroducing those foods that you think you might be allergic to. Like every couple of days, introduce one at breakfast and eat that one for like dinner. So it's spaced out far enough where you could tell what kind of reactions you're having, if any. And if you're not having any, then after a couple of days of just doing that one, you can add in another one. You want to keep a really good food diary whenever you're doing this so that you know, you can remember what food you reintroduced, you know, what type of reactions, if any, you had, and you can figure out what all's going on. But if any time, like during the time period, you're not eating the allergenic foods, and you're still showing symptoms, then it might actually be that you're allergic to one of the ones I named off that are considered hypoallergenic. Now, the food allergy that I've had experience with, and it was a hard one to get past and figure out at the time, is the milk allergy or lactose intolerant with my daughter. When she was, oh gosh, like a month old, if maybe even a little bit younger than that, she started having colicky type symptoms. She would projectile vomit. We couldn't figure out why, and I was breastfeeding on top of that, and so I would just slowly pay attention to when it would happen, and so I tried, you know, sugar water, which she, you know, at first she wasn't getting nutrients because I didn't know what to do, or much anyway, so I had her on sugar water. I used like pear juice and water mixture with rice cereal, really, really thin, just so she would have something in her stomach. And I started experimenting with formulas. I went through every single type of formula, from soy to Enfamil to Gerber to everything that they had on the market at that time. Nothing, and I mean nothing, worked. I started researching what the labels had in it. They all contained lactose. I did a little bit of research on the internet, which back in '94 was very, very lacking. I was going to college at the time, so I would do most of my research at the college in my spare time. So I found out that not only does breast milk have lactose in it, because it's a natural milk sugar, then all of those formulas had lactose in it as well. So milk allergy and lactose intolerance comes in when the person doesn't have lactase, which is the enzyme to be able to break down the lactose. So she didn't have that from birth. So her entire life, and with the milk allergy came the asthma. Like I said, that's one of the symptoms. So she was on breathing treatments 4 times a day, and she was on a lactose-free formula for almost 3 years. Then we had to switch her over to goat's milk because that's the only animal milk that does not have lactose in it. And she drank that for probably about a year and a half. And then we gradually had to reintroduce milk back in just to see if she could tolerate it a little bit better. which she, during her entire life, she probably was able to drink maybe 16 ounces of milk a week without it bothering her. But ice cream never bothered her for some reason. It was kind of weird. So my grandson came along. He was totally fine for 2 years, or 2.5 years. He was totally fine. And then one day, he just started showing symptoms of the chronic diarrhea anytime that he would have milk. And he loved milk. So, I mean, and he had excess mucus, always had ear infection. He had a lot of ear infections, a lot of sinus infections, and, then the diarrhea. And we finally figured out that he was showing symptoms of some sort of allergy. So she figured it out that it was milk that he was allergic to. So daughter and grandson both milk allergy or lactose intolerant. So as you can tell, it's very difficult sometimes to get past a food allergy, but it's not impossible. And just remember that the skin pricks test for food allergies or any type of allergies are not 100% accurate. Like I said, there's 10 to 15% accurate. So anytime you're thinking there's a food involved that may be the culprit of your allergies, eliminate it with the elimination diet, and see what you can come up with. If you're still at a loss, you might want to consult a doctor anyway, just to get some help on maybe a more restrictive elimination diet. So I hope you enjoyed it. Remember to still stay tuned, because there's a surprise coming in a couple of days. So I will talk to y'all soon. Thank y'all.